Welcome to another episode of MedTalk. During this public health crisis and pandemic with COVID-19, we are continuing to provide you with discussion on important medical, dental, and mental health topics. Today, we are having a discussion on a unique topic which is considered a social taboo, and there are a lot of misconceptions and misunderstanding. Our special guest today is Dr. Amy Divaraniya, who has more than a decade of experience in personal genomics and biomarker discovery. After facing her own struggle with conceiving her son, she set out to build a solution to help women experiencing difficulty getting pregnant. So let's hear from Amy. Welcome to Amy to MedTalk.
Thank you so much for having me. I really appreciate it.
So Amy, we are in 21st century and so many technological advances and available tools. Infertility is very challenging to treat for medical community. And I want to start by asking a very basic and important question. What is infertility and when does it become official that someone has an issue conceiving?
Sure, this is a really important topic because I think, especially in the South Asian community, like this is not discussed. It's a very stigmatized issue. So infertility is clinically defined as a woman who is under the age of 35 and has actively been trying to get pregnant for 12 months and has been unsuccessful. If she's over the age of 35, then she's been trying to get pregnant for 6 months and has been unsuccessful.
Okay, so is infertility becoming more common now than before? And why is that? When I was in the medical school 35, 40 years ago, infertility was common at that time also, but is it more prevalent now than before?
Yes, I think so. And you can see that with the growing, or I should say the declining rates of fertility in women. The reason is because I think women today are just really goal-oriented, want to hit certain career milestones, they want to get higher education, and all of that takes time and it ends up delaying when you decide to start growing your family. You can also see, like, even within our community, girls are getting married later in life, and I mean, traditionally you don't have children before you get married, so you find yourself in your late 20s, early 30s before you even start considering growing your family, let alone actually giving birth. That's not what we were seeing a decade, 2 decades ago. Typically, women should be getting pregnant, or our bodies are designed to get pregnant in their early 20s. And like, if you look at the generation before mine, that's what was happening. And you didn't see such a high rate of infertility a generation ago as you do now.
Yeah. So I spent half of my life in India and now more than half of my life in the US. And oftentimes society blames women if they can conceive. Is an infertility a male or a female problem? Can you explain to our viewers?
Yeah, it's both. It's very easy for us to just blame the woman, saying that it's a problem with her. I mean, and more often than not, it is. There are a lot more factors on the female side when it comes to infertility than on the male side. However, that the male side should not be discounted, right? It takes 2 people to make a baby, and both need to be functioning and in unison in order for this to be successful. So, I mean, there's a lot of issues that can happen in males as well when it comes down to sperm, mobility, the quantity. There's a lot of factors there. But on the female side, obviously, there's a lot going on too. One of the bigger issues is that as a woman ages, her menstrual cycle gets a little bit more irregular with every passing year. And once you hit the age of 35, you see this drastic increase in infertility that happens. Like, you're talking about an exponential increase. So it's very easy to blame the woman and say that it's something that we have to fix on the woman's side. But if you are going through infertility treatments, it's definitely important for your clinician to test your partner as well.
So do you agree that the physiological and pathological problem in women is more than men can have in their sperm count or any other pathology in men? Do you agree with that?
If you're talking about the number of issues that can happen between female and male, I agree. But now if you're talking about how prevalent it is, I don't necessarily agree, because I think it depends on a lot of things. as a woman is usually getting older when she's trying to conceive, usually the partner's older too. And sperm has a direct correlation with its activity and its effectiveness as a male ages. So I would agree that if you're looking at the number of things that could possibly go wrong on the woman's side, that would pathologically, physiologically be more than what could go wrong on the male side.
So society doesn't have to blame women all the time. It has to be a joint
Right.
effort, male and female. So I think that is the message across. We need to ensure that our community, our society is aware of that. Don't just blame women. So thank you for clarifying.
Yeah, absolutely. And I think that's something that is so ingrained in our system too, right? Like, I think just in the past few years have even the clinics in the US begun to actively test the partner. That wasn't the first go-to. Usually they would run a whole slew of tests on the woman and then test the partner if nothing worked. And now clinics are starting to kind of evolve and test the partner at the same time that they're starting to test the woman to kind of say, all right, it's not on the male side, so we don't have to worry about that as a factor. Let's focus on the real problem here. In India, though, I don't think that's the case. And I think they put the woman through a lot before they even consider a male having an issue. And it seems to be a very stigmatized thing to say that it's on the male side versus the female side.
I'm glad you brought that up because I have experienced myself in India when I was practicing, and I think it's a very unfortunate and sad circumstance there. And I hope people thought process changes over time, but it is still a huge issue back home in India. I agree with you. So besides the pathological and physiological issues in men and women, does anything else, does age affect fertility overall?
It does. So just on the basic, like, quick biology lesson on how, like, a woman can get pregnant. We're taught in health class, like, you get this basic sex ed, right? That if you have intercourse, you're going to get pregnant. And that's really not the case, because in a woman's cycle, so she has a period every month or at a regular interval, there's only 3 to 6 days that she can actually conceive. And you want to try to time intercourse in those 3 to 6 days, because that's when she's releasing an egg. You want the sperm to be present when she releases the egg. And then if all goes well, she conceives and you form an embryo and that turns into a baby. Now, the difficult thing though is, as a woman ages, she may not release an egg every cycle. Her cycles usually get more irregular. She has a lot of hormonal imbalances that can start to happen as she's aging. So you actually see this exponential increase in infertility that occurs between the ages of 34 and 35.
Yeah.
And like, so I think a lot of women have in their minds, like, I need to have a baby before I'm 30. I need to get pregnant before I'm 35. There's a reason those, like, milestones are in your mind, and it's because your infertility does increase as you age.
So besides age, how about we are all in the fast moving world, technological advance, we have a lot of stress, work stress, outdoor stress, family stress. Does stress has any effect on infertility or become fertile for women?
Yeah, I think it actually impacts both men and women in the same way. So there's a lot of studies that are looking at the how stress is impacting fertility. Most of those studies are done looking at stress levels during a fertility treatment. So you're already going into the clinic for some treatment. And those processes actually are stressful in themselves, right? So what a lot of these studies have shown is that when you have elevated levels of stress, the success of those treatments actually drops. But there's mixed reviews on it. I do think that stress impacts fertility quite heavily, because you're directly influencing how your hormones are going to be behaving. And you can tell, right? When you're stressed out, you don't feel right.
Yes.
There's certain hormones that are definitely getting impacted at that point, but there's no, like, our bodies aren't that siloed off that your whole, like, all your systems aren't going to get impacted by stress. So I do think there is a significant effort that happens when you are stressed out, and it will impact your fertility results.
So Amy, the infertility is an issue in all cultural, all different backgrounds. And I know South Asians are not immune to that. So let's talk about infertility in South Asians. How prevalent infertility in South Asians, and what are some of the common causes of infertility, specifically for the South Asians, Indian, Pakistani, Bangladesh, Pakistanis, and other subgroups of South Asia? How prevalent is that?
So it's pretty prevalent. It's difficult to put an exact number on it because it is such a stigmatized topic, and I think a lot of women don't report that they have gone through fertility struggles until after the fact. So it's very underreported. And that's across the whole board. It's not just unique to South Asians. But in general, infertility affects about, I want to say like 30 to 40% of the female population. It's of couples, I should say, right? So if you look at like the exact statistic, it says 1 in 8 couples experience infertility, but I believe that to be much higher because of the fact that this is not discussed. Now, it does impact South Asian women. And we just did an event last week where we talked about how infertility doesn't show any bias. It impacts everyone equally, right? It's not specifically going after white women or Black women or South Asians. It doesn't care. So the reason that I think that it's actually impacting South Asians so heavily is because there's a lot of underlying issues that can lead to infertility, such as polycystic ovarian syndrome, endometriosis, hormone imbalances. These are issues that are very prevalent in the South Asian community, and it has a lot to do with the fact that diabetes is so prevalent in South Asians, right? So polycystic ovarian syndrome, one of the leading causes of that is having insulin resistance. And we're basically made for that. Look at our diet, look at our history, like that is what South Asians, our number one fear is in South Asians is to get diabetes and have heart disease, right? So I do think that infertility is a lot more prevalent in South Asians than we give it credit for.
And some of those related medical conditions, if treated, can definitely reverse the infertility. Is that true?
It can have an impact. So like I would say for polycystic ovarian syndrome, there's a lot of treatments that doctors try, right? Like you can go on metformin to try to regulate your sugars. You can go on birth control to try to regulate your period. You can even have surgery to remove cysts if that's actually the case. But I do think there's a lot of treatments that you can do naturally. So monitoring, very simple things that we know we need to do, but just don't really take care of ourselves enough. So eating a balanced diet, regular exercise, hydrating, like these are all really important things that will impact our fertility in a positive way.
Yeah, so Amy, one thing I always am very curious, so I have seen it. If a woman conceive once, had a baby, can she become infertile again? Is that possible?
It is so common. It's actually been coined as secondary infertility, and that doesn't mean just your second baby. It can happen your third, your fourth, anything. A lot of women have a simple time getting pregnant the first time, but they're also much younger than when they try to do it again. And after you give birth, your body has been through a trauma, right? There's a lot of stuff that your body has just gone through to deliver that baby. And the way your body heals, it's not the same body it was prior to the first pregnancy. So the fact that a lot of women experience difficulty in their subsequent pregnancies is not an uncommon case. And I think women shouldn't be so hard on themselves. They should give themselves the credit that they were able to deliver that first baby and acknowledge that their body has gone through a massive change and it's not the same body that they tried to get pregnant several years prior, even if it was 18 months prior. There's a lot that has happened.
Very good. That was very good explanation about the secondary infertility. So what do you think the biggest gap in the fertility space is right now?
Oh gosh, this is a loaded question. So there has been a lot of innovation in fertility, right? Like, so when you talk about IVF and IUI, so in vitro fertilization, intrauterine insemination, these procedures that doctors are doing are amazing, right? That they're able to actually basically put an embryo into a woman. They make the embryo in a petri dish and then they insert that into a woman and then she can have a full-term pregnancy. It's absolutely amazing. But the problem is that going from a woman deciding I want to try to have a baby to going to IVF, there's a huge spectrum there that is not being solved with any solution today. And you're talking about like a cheap, like maybe $10 test from what you can do at home to a $15,000 to $20,000 procedure for when you want to go through IVF. So think about what that dichotomy is. Like you're creating such a big span of a huge gap. Really. So in my view, I think the biggest gap in the fertility space is that women aren't provided with the information that they should have about their body to take control of their health and take control of their fertility journey. And so I know you spoke in my intro, but my background's in biology. And to me, that means that we need to understand what our hormones are doing, because that's what's dictating my reproductive system. So if I understand how my hormones behave in an accurate way, then I can know what's going on with my hormone profile, and then I can decide what I need to do when I need to do it. So to me, it's about educating the community and women about their own body and giving them that personalized care that they all deserve, and that should be the status quo now.
Very good. So if a woman is experiencing difficulty in conceiving, what can she do? Can you provide some tips to diagnose and management of infertility? And I'm sure there are some ways women can help herself for a successful conceiving to become pregnant and have a wonderful life. So what is your advice? What can they do right now? What is available in the market?
Sure. I mean, so like if you decide today, like we're ready, let's start trying to have a baby. The first thing you need to do is really understand what's going on with your body, right? So is that just getting ovulation tests that you can purchase from your local CVS, Walgreens, and see like when your luteinizing hormone levels are starting to peak, so you should have intercourse then? That's a great way to start, just to understand what's happening. I would also recommend probably looking at some fertility tracking apps so you can start tracking other things that your body tells you. It's pretty amazing how informative your body can be, right? Like things that we kind of ignore, like this is kind of disgusting, what's going on with my body, like your cervical mucus, that's actually really informative about what's happening with your fertility cycle. But then the drawback with the tools that are currently on the market is that you're really getting this subjective data. So is it positive, negative? It's not giving you any objective measure of what's happening on a daily basis with your menstrual cycle or your fertility. And that's why a product like what we've developed really comes into play, because we actually educate you on your menstrual cycle, we educate you on your hormone levels and track that over time.
So what is the product you have in mind?
Sure. So we've developed OOVA. It's an at-home test that monitors 2 key fertility hormones in the privacy of your own home. So we measure both luteinizing hormone and progesterone, and we track this data over time. So the one thing that we didn't really touch on is the fact that I had a very difficult time conceiving, and that's kind of what drew me to creating OOVA today. I had irregular cycles my whole life, and I knew that I was going to have a difficult time conceiving, and we did. It took us 18 months to conceive my son, but those 18 months were so devastating for us because I was doing everything right. I was using the ovulation test. I was using the fertility tracking apps, and I wasn't learning anything about my body. So that's where this drive of like, let me figure out how my hormones are behaving came in. And what we've done with OOVA is we've built this whole personalized experience for you. So when we learn your hormone levels, we're not comparing you to some standard threshold or this perfect woman who doesn't exist. We determine what your hormone baselines are and then detect fluctuations by comparing in your hormones in that way. We also get smarter with every use. So we have a whole machine learning algorithm that gets smarter with every data point that we capture. And then we provide you with a report that shows you exactly how your hormones behaved in that cycle. So you know when your most fertile days were. You know whether you ovulated or not. Did you release an egg this cycle? And it's all based on urine, and it's all done in the privacy of your own home. And if you are working with a clinician, they can view your hormone data in real time as well. So we have a whole clinical leg of the company that would actually enable them to do that too. I can show you what this looks like if you'd like.
Yes, go ahead, please.
Sure. So the kit comes with a countertop holder, a handle, and then a month's supply of disposable cartridges in a box like this. And each cartridge is individually sealed. When you take it out, it looks like this. So this is a urine pad, a QR code, and then a window that will show you 1, 2, or 3 lines. So once you provide a urine sample on this test strip, you wait 10 minutes, and then this works alongside an app. So once the timer in the app goes off, it opens up the camera on your phone, and then you just scan this cartridge using the camera on your phone, and we analyze the test lines for you. So you don't have to sit here and say, is the line darker or lighter than yesterday? We do all the analytics for you. And then we tell you exactly where you are in your menstrual cycle. We also take out a lot of the guesswork. So one of the big pain points I had when I was trying to conceive is I didn't know what days to test because I had such an irregular cycle. OOVA does all that for you. So we'll tell you exactly what days to use an OOVA strip, so you're not wasting them and you're not using them on days that you don't need to.
So very nice advanced technology, and I think people should take advantage of it. So Amy, I have a curious question. So you conceive naturally without any other treatment, is that right?
That's correct.
And how old is your son now?
He just turned 2 a couple of weeks ago.
Congratulations. So what is your departing message, take-home message for our women population who has issues with conceiving or has any questions regarding infertility? What is your take-home message for them to get encouraged and not give up their hope?
I think the one key message I'd like to share is that you should be your own advocate. So you might be experiencing difficulty getting pregnant. Don't think something's wrong with you. There isn't anything wrong with you. This is just a challenge that you need to figure out how to kind of get over. There's a lot of reasons why you might be facing difficulty getting pregnant, but the answer to that is knowledge and information. Don't sit in a black box and kind of blame yourself for every decision you've made that's led you to this. That's not what is happening right now. You just need to understand what's happening with your body and give yourself that time to get that information. Get the right tools, talk to the right people, go to a doctor you trust, and educate yourself on what is happening before you go down that dark rabbit hole of self-doubt and not loving yourself anymore. Because I was there. It's a horrible place to be. It's very lonely, and no woman should ever have to experience those emotions that I went through. I want to try to do everything I can to prevent that from happening again.
Wonderful. Thank you so much, Dr. Amy Divaraniya, for that discussion on infertility, clearing up some misconception, misunderstanding, available tools, and how you can help yourself to conceive and have a wonderful life. So thank you so much for your time in coming to MedTalk. And I am so thankful to you to come and discuss this very not so light topic, and you made it so in layman's term to people to understand. So I'm so thankful to you. Thank you so much. Wish you all the best. Keep up the good work, and congratulations on your successful conceiving as well.
Thank you so much. It was so nice to talk to you, and I hope that some of our tips help at least one woman out there.